when it comes to root cause medicine, we want to figure out first and foremost, where is that fibromyalgia coming from? Because, it's not fibromyalgia, it's not chronic fatigue, because that's just a symptom.
Welcome to Root Cause Holistic Health. I'm Dr. John Harmon, physician, brain health expert, and your host on this no-fluff journey into whole body healing.
And I'm Tracy Green, wellness coach, mom, and co-host. This is the space where we get real about what actually heals, not just what's trending.
If you're done with surface level advice and ready to understand your body, your mind, and your health from the inside out, this podcast is for you.
We're here for the raw conversations most people avoid. We don't sugarcoat, we don't shame. We offer tools, truths, and transformation.
Hi friends, welcome back to Root Cause Holistic Health. Today, we are very honored and excited to have a guest with us that I will let Dr. Harmon introduce and go over his backstory. And we will dive right into this incredible doctor that has touched so many lives in the Treasure Valley. Doc, take it away.
All right. Yes, the Treasure Valley, that happens to be in Idaho. And so both Tracy and I know Dr. Palacios. He goes by Dr. David, mainly because he got tired of spelling his name. Dr. Palacios used to practice up in Portland, but we are so privileged to have him here to bring all of these treatments and protocols to this area. Both of our lives, our families' lives, have been benefited by Dr. David. And that's one of the reasons we wanted to have him on this show, to share him and all of the possibilities with the treatments that he does, either here in person or through telehealth. So no matter where you are, would you say in the world, Dr. David?
Yeah, I mean, technology just gives us that opportunity, right? To work from all over the world. And I'm very used to always telling patients or reminding them that I'm calling them at, 12 Mountain Standard Time, which means this time, your time. Always calling and talking to
That's in the middle of the night in South Africa.
Depending on where you are in the world, right? So
right.
I can work with people for all the United States, and there are some international people that I've worked with so far, yeah.
So Dr. David Palacios is a naturopathic medical doctor. He'll explain what that means and the doors that opens up to be a naturopathic medical doctor, especially here in the state. I don't know about other states that you can tell them about, Dr. David. So Dr. David specializes in acute and chronic pain resolution, for chronic degenerative diseases like autoimmune disease, fibromyalgia, and chronic fatigue. He also has a passion for taking care of families in a holistic primary care setting. After earning a bachelor's degree in biology with an emphasis in cellular and molecular biology and a minor in music, I did not know about that about him. No wonder I like you. I played in a band for 8 years.
Yeah.
He completed his 4-year medical training at the National University of Natural Medicine in Portland, Oregon. He also completed an extended residency which centered on acute and chronic pain and chronic disease resolution, hormone balance, pediatrics, and general primary care. Dr. David focuses on root cause medicine, interesting, the same name as our podcast, to resolve chronic disease and chronic pain. Dr. David takes a detailed, patient-centered, natural and holistic approach, and I can tell you that from personal experience, to bring about optimal wellness and function to the individual. He believes natural therapies should be first-line defense in treating illness and disease and should be exhausted before pharmaceutical invention is ever considered. If patients are currently taking pharmaceutical medication, his goal is to work these patients off the pharmaceutical intervention or significantly reduce their medication. Dr. David utilizes a variety of conventional and naturopathic treatment modalities to best establish optimal health and wellness in his patients. Some of the modalities include neural therapy, Ozone IV therapy, and prolozone therapy, and other regenerative injection therapies, botanical or herbal medicine, and peptide therapy. One of the things that impressed me as well is that you do have prescriptive rights.
Yeah.
And sometimes the herbs and the vitamins ain't strong enough to kill off some of the chronic things that people have. So that's one of the things that is great about you, is you're able to recognize that and actually prescribe some of those things, like for chronic candida and mold and different things. But
Yeah.
Dr. David, welcome to the show. If you could describe your practice, I think that would be best, just hearing from you.
Absolutely. So over the years, my practice has really evolved into working really specifically with what I would consider the more mystery type of cases, the world of autoimmune disease, fibromyalgia, chronic fatigue. I work with a lot of chronic pain where patients have seen, lots of different practitioners that do different modalities. By the time they get to my door, we're usually somewhere in the realm of, 5 to 15, 20 years down the road in terms of their diagnosis.
Yeah.
And really, when you think about it, coming into an office with the diagnosis of fibromyalgia is not really helpful for patients. When you go to the doctor's office and you tell them you hurt everywhere and they diagnose you hurting everywhere, you already know that, right? If you go to the doctor's office and you tell them that you're tired all the time and the doctor says, you know what, I'm going to diagnose you chronic fatigue, which means you're tired all the time, that's not helpful, right? So these patients, I think, are really looking for therapies or alternative thought processes out there because the Western medical model has not been able to serve them in a manner that's healing. It might be helpful in terms of, maybe what I would call like a Band-Aid approach, or helping have tools to help you feel better or get through your day or give you some energy or, whatever that may be. But when it comes to root cause medicine, we want to figure out first and foremost, where is that fibromyalgia coming from? Because, it's not fibromyalgia and it's not chronic fatigue, because that's just a symptom. I want to figure out why you have that symptom, and then we treat that directly. And lots of great modalities to do that. And kind of like what you said earlier, by the time patients make it to my office, we are way past vitamin D, right? We are way past magnesium. We're way past fish oil and probiotic, right? Like those are all great things, general health and wellness tools. But in terms of the patient population that I work with chronic debilitating disease, there are other more aggressive tools that we'll go into detail about that are really life-changing for these patients.
And what I hear you saying, there are a lot of different things that can cause someone to have chronic fatigue.
Absolutely.
Or for their body to hurt. So you, instead of just saying, I'm going to diagnose you with, you have no energy, chronic fatigue,
right?
I want to find out what's going on.
Yeah.
So how do you do that in your office?
Yeah, so a lot of the world of chronic fatigue, fibromyalgia, autoimmune disease comes down to, I would say 90% of the time, some sort of infection in the body. So I think doctors of the future really need to be masters in genetics in terms of how the body works from a biochemistry standpoint in the genetic world, and then need to be specialists in infectious disease. So I think that's where a lot of medicine is headed. And even over the last 5, 10, 15 years, we're seeing a lot of studies coming out regarding the body's interaction with infectious disease and how that manifests in terms of symptoms, whether that's chronic fatigue, fibromyalgia, autoimmune disease, cancer, lots of different things that we can get into detail as well. So we run quite a few tests to kind of get to the root cause, like we talked about. Again, a lot of the patients, when they see me, they've done the MRI and the CT scan and the regular labs, and they're kind of tired of hearing everything looks great, right? Go home and you're fine. And then again, a lot of those patients, especially my females, unfortunately, get every excuse in the book of, it's just the kids, it's just the family, it's just menopause, it's just the career, it's, you know what I mean? It's like, and they're over that too, right? So that they know it's not just that, right? Or I have, a bodybuilder who ended up with having 12 to 15 seizures a day. It's not just stress, right? There has to be something else going on that's leading to that issue. And that patient, after 2 years of the Western medical model, was diagnosed with functional seizure disorder, right? That's not helpful. She already knew that she's having 12 to 15 seizures a day. So to spend 2 years in the Western medical model for a diagnosis that doesn't tell you anything, again, is really frustrating. In that case, that patient was diagnosed with severe mold toxicity and Epstein-Barr and something called cytomegalovirus. You can easily Google right now papers indicating the link between mold toxicity and neurological disorders, as well as Epstein-Barr and neurological disorders, cytomegalovirus as well. A lot of people don't know that the number one cause for mono in the United States is Epstein-Barr. So it's a very common question that I ask in my practice is like anyone, either you or in your family had mono, and, that kind of helps guide my conversation and my thought process of what types of testing we need to run. You won't walk into my office and I'm not going to test for literally everything, right? I'm going to take a good case like we've talked about and, verify my thought process and direction. And I might have some tests that I have in a specific order where I say, let's run these tests. If they're negative, then we'll kind of broaden our search a little bit. Sometimes patients can get overwhelmed when you throw too many things at them. My goal is to really make that framework really straightforward and easy to follow and just give patients an understanding of this is what I think is going on. Let's get the testing done. Once we verify an actual diagnosis, then we'll talk about what are the tools at this point that we can be using to make sure that we get rid of these infections, which then in turn will actually resolve your chronic fatigue and fibromyalgia or autoimmune conditions that you're dealing with.
That brings me to a question. Would you say there are people who end up in your office and you run those tests? And I know what tests you're talking about, where you're looking at the genetics of the critters that could possibly be inside of you or the markers of certain viruses and things.
Yeah.
Would you say that some people are walking around with chronic fatigue or, something more serious? For example, Lyme as a result of Lyme disease or Epstein-Barr, and they never knew they had it.
Right.
They didn't have the telltale sign of the target rash, or they didn't get diagnosed with mono or something like that. And yet here they are in their 40s or 50s and they're tired all the time.
Yeah, I just read an article recently. It was a meta-analysis of lots of different studies combined specific to Borrelia burgdorferi or Lyme's disease and Parkinson's, dementia, Alzheimer's, right?
Yeah.
They're symptoms. I don't consider those true diagnoses.
No.
The Western medical model in the article is saying, hey guys, we need to really pay attention to these types of infections because we're missing a lot of these cases and diagnosing them with late stage whatever when we could have intervened 15, 20 years ago and taken care of this infection and prevented this long-term, debilitating neurological disease in this patient. I have a patient right now I'm working with from Utah, very healthy, great runner, lived a good life, did a lot of hiking, right? Mountain stuff, high exposure risk to critters, bugs or ticks and those types of things. He started having issues in his 45, 50 years old. He's about 65, 70 at the moment. And, brain fog, memory, focus, concentration, his coordination is way off. His wife is doing most of everything in terms of taking care of the home and finances and all of those things. And we came to a diagnosis of Lyme's disease and a specific infection called anaplasmosis. And when you look at these infections, sometimes when these infections reemerge, so sometimes these things can lay dormant, right? And then they kind of reemerge and create a bigger immune response or reaction in the body. They start to lead to these neurological changes or physical changes in the body. So that was a big eye-opener for that family who, again, has spent the last 15, 20 years in the Western medical model. So even the conversation sometimes with these patients is a little hard to begin with because it's something that it's new to them and they haven't been exposed to. They're working with specialists in the field of Alzheimer's and dementia, and they're just sitting there scratching their heads as to why they've never been exposed to any of this information before. And the beauty of our medicine, or how long I've been practicing, is at this point I can say, well, go talk to these 3 patients who've had similar issues, right? And they would love to tell you their story and talk about how I was able to help them. And that's the beauty of where we're at in our practice, where, at this point, you don't really have to take my word for it. And a lot of patients are referrals anyways. I do have those occasional patients who are pretty skeptical, which is fine. And I love that, because that gives me an opportunity to be an educator and, again, open their mind to other thought processes of what else might be going on in the body. It is kind of this interplay, right, of making sure that patients have a good understanding of where I'm coming from in my thought process. And that's why I like doing the testing, because if you come into my office and I start recommending a bunch of supplements and all of these therapies without figuring out what's going on, that's a red flag to me as a physician for other practitioners out there working with other doctors. I need to do the due diligence of figuring out what is going on, and then I can be extremely accurate and precise with my recommendations moving forward.
That's what I've observed about you as well. Looking back, kind of a personal note, my eldest sister went from beautiful homecoming queen, married a Florida State basketball star, had a couple of kids, and all of a sudden she started having these mental issues.
Yeah.
And Dr. David, she ended up in mental hospitals. Nobody could figure it out. They just said, well, something flipped in her brain.
Sure.
And ended up living in a group home. And I look back, we, like you said, outdoors a lot. We went camping a lot. Nobody ever told us about, that tick that bit. You could have had something. So anyway, I wish you would have been around about 50 years ago.
Yeah. Unfortunately, I have a lot of patients, once we come to the diagnosis, they're like, I wish I had this information 15, 20 years ago. So almost exactly what you just said.
Yeah.
And it's really fascinating to watch the psychology working with patients as I work with them, because going over lab results is kind of like a birthday and funeral at the same time, because they're super excited to have answers. They're really upset and angry that they've spent the last 15, 20 years without answers.
Yes. Thousands of dollars.
They're really sad, right? And emotional to think about the life they consider wasted over the last 15 years of
I get that.
Not being present with their family or their spouse. Or I have a nurse that I'm working with right now who got sick when she's 18. She's 39. She didn't marry, didn't have kids. She's doing so much better, and she's super excited about that. But she's now processing the last 15 years of that lost time, where she's now looking at her as a healthy individual and doesn't have a family and all the things that she wanted in her life. So, getting through the diagnosis and the infection is one thing. But again, when we talk about holistic care, I'm also helping patients walk through the, trauma, literally, of that diagnosis and what it's done to their lives and how we move past that and what does this next phase for you look like? Because a lot of people, again, don't know who they are anymore at that point.
I get that. And you know what, most people would never cross their mind. Somebody who goes throughout their life, they're sickly, they can't do anything, not attractive to a mate. And then looking back, look at the 30 years I lost. That would be pretty tough.
Yeah. So, when I first started my practice and I was healing patients, and sometimes they'd come back in with like severe depression or anxiety, I didn't understand it at first, because I was like, hey, you're better.
Sure.
Go live your life and be happy, right?
Nobody told us about this, and we're going to med school.
And as a naive practitioner, I was like, we just cured your issue. You should be all good, right? And, we kind of sit, and as I sit with patients and listen and kind of go through the 15-year history of like, yes, I'm better, but now that I'm better, I don't know who I am, because I became my illness, right? I was that disease.
Yeah.
Right? Fibromyalgia was who I was. Chronic fatigue was who I was. Everybody knew that I couldn't do X, Y, and Z. I'd have to stay home when the rest of the family did other things. So yes, I'm better, but I need you, Dr. David, to help me process all of that loss, right?
That feels so heavy to me.
It is heavy. It's a beautiful burden to be a physician. I am very blessed. And
I can tell you don't take it take it lightly.
No, it's a vocation. It's a calling. It's something that I take very seriously. And I have a huge faith background as well, where that's really important to me. And there's something very doctors know more about people than even sometimes spouses or other family members do, right?
Sure.
So they go into more detail with me than they will anybody else. So I mean, that trust, that rapport, that relationship, I mean, is really sacred in many ways. It's like I was saying, like, I have a counselor not because I'm have anxiety or depression or those types of things. But I mean, when you help carry the burden of all of these things, it's good to have someone else outside of yourself help you process that as well. Right. So a lot of times these therapies are very reactive in nature. For me, I don't want to go 15 years down the road and get burned out, right? Because I'm holding on to all of my patient's trauma that I've been helping
carrying the load.
Yeah. I want to be able to, through that, and make sure I stay healthy so that I can continue to keep helping patients, right? So I like to be even proactive in my health and working with counseling and those types of things so that I can be more present and be more open and be able to take on that burden with them and walk through that and then be able to release that burden.
It's like you have a bucket and the bucket gets full and it's full of emotional stuff.
Yeah.
And you have to have a place to dump that out. And what you just described is a wonderful way to do that so that you can be that pillar for them who are going through such a horrible realization. Like, I lost the last 30 years, man.
So we had a whole class, I think a whole 2 years in medical school for naturopathic medical school called Dr. Heal Thyself. And that's really important. You're not going to get that in Western medical school, right? So, I mean, it's one of those things where, like, if I'm not taking care of myself, how am I supposed to take care of, my patients, but obviously my family, right? I mean,
right.
The priority structure of, faith, family, and then vocation. And I mean, making sure that that's in the right order is only going to be helpful for me to help as many people as I can, but also maintain my healthy relationships and making sure that my kids turn out to be good human beings and my spouse is happy with me and all of those things that are important, right?
Part of your own life. Gee, you're helping everybody else. You got to take care of yourself.
Yeah.
We've talked a lot about older patients that have lost 15, 20 years.
Yeah.
We have a lot of moms that are listening. And of course, I'm a mom. So let's talk to the moms out there. I know that there are a lot of moms that have kids that they have been to several different doctors. I was a mom that had taken my daughter to 13 different doctors before I found Dr. 14, which was also a naturopath.
Yeah.
He found out what was going on with my daughter. So let's talk to the moms and let's talk about what you're seeing most common in the kids today. I'm sure you're seeing common threads. So let's discuss, the kids in your practice.
Yep. So common one, hey, my 14, 15-year-old got sick and she's never been the same. She's 18, 21 years old now, trying to figure out what's going on. The Western medical model has diagnosed her with depression, but she's chronic fatigue, right? Really frustrating as a parent to have a diagnosis, again, that's not super helpful. They don't know what to tell them, so they say, I guess you're just depressed, right?
Oh.
And, when I talk to patients, I'm like, hey, if you weren't tired all the time and you were able to do everything you wanted to do, would you be depressed? And they'd be like, absolutely not. And I'm like, okay, well, you're not depressed. Your depression is a symptom of you not being able to live and experience the life you want to have. So let's get rid of the chronic fatigue, and then your depression is going to vanish because you're going to be doing everything you want to do, right? So, for those moms, 14, 15 years old, got sick, never got better. I get a lot of, we moved into a new house and everything kind of went haywire after that.
Oh boy.
Sometimes kind of putting those pieces together. We can have a whole another discussion on that. And I'm future in terms of environmental medicine. Mold exposure is a huge one that I'm seeing, especially with little kids. Scary statistic in the Northwest, I work with a guy named Dr. Mark Arvin, who does in-home analysis. He's been doing it for the last 39 years. In the Treasure Valley, he's finding that 30% of brand new builds already have mold issues. That's insane, right? And that's policy, right? So, I mean, that's we can have a huge conversation about this too, where yes, we have more sunny days here, right? So the assumption is if it's sunny and dry, we can keep building. The problem is that in Idaho, we keep building through the winter. And even if it's sunny, it's super cold, so nothing dries, right? So even though that it's sunny, that's not super helpful. The material's still wet, and they just literally cover it right up and keep...
Wow, sheetrock over it.
Right? And then, you move on and that mold issue continues to fester and grow. And by the time patients actually see mold in their house, it's a really big problem.
Wow.
The majority of the time, because we're talking like seeping through drywall, coming from the ground floor. So like by the time it's visible, it's probably been an issue for years at that point. So a lot of times I'll talk to patients about mold exposure. They'll say, not that I know of, right? We'll do a mold test, which is a urinalysis to figure out, if there's 16 different types of toxic molds that we look at. Depending on what comes back positive, we decide, what the framework is in terms of treatment plan. But that's half the battle. Once we have that diagnosis, I need to figure out if you're currently being exposed to that, because I could treat you till the cows come home. But if you're living in a moldy environment, there's very little I can do for you. And I'm super honest with patients about that too, right? Like, I'm not going to sit here and put you through a bunch of protocols. If you're living in this moldy environment, a couple things need to happen. We need these are tough family conversations, because you need to move out, right? Is that possible? You need to rent a space, but maybe still have your mortgage. Is that even possible? Do you remediate the house while you're living in it? And then at that point, we have to find remediation companies who know how to actually remediate appropriately. Because a lot of these companies will come in and just tear everything up, but then they're just spreading mold all over the house, right? And it becomes a bigger issue. I mean, there's so many pieces to this puzzle. And it's really good to have someone like Dr. Mark Arvin on board, because I work on the medical side of things, and he will make sure that the proper contractors are brought in. He will make sure that the cleaning of the home, that's literally called a forensic cleaning, where we will hire someone to clean pretty much every single item in the home. Depending on what your house looks like. They did that in our house, so that way, patients know I practice my own medicine. We had a leak in our home. Dr. Mark Arvin came over, found it in the mudroom. We did a mold test during inspections to buy this house. It came back negative. He came in and found it when he did his professional testing, because he's way more thorough than just like a random $30 Home Depot mold test, right? He diagnosed and found the issue. So he's basically a doctor for your house, right? So not only testing the space, but he had to test the rest of the house, because at some point you have to think HVAC system, spreading mold throughout the house, through all your air ducts, right? I mean, it turns into quite the ordeal. Took about a week for this lady to go through, like I said, pretty much every item in our home and clean it in a very specific manner. And obviously doing proper remediation with blocking off the area you're treating, having negative vacuums involved. So there's so many pieces of that puzzle. Again, we can have a whole separate podcast on just...
Wow, that sounds so detailed.
If you miss any of those pieces to that puzzle, you're going to have a hard time getting that patient better, right? I have a ton of patients who have treated mold. Okay. And like we said earlier, you were talking about prescriptions. And when they meet me, they said, "Oh, I've already done that." And I'm like, "Okay, tell me what your mold protocol was." I was like, "Oh, I was on binders for 6 months." And I was like, "Okay." That's going to maybe lower your mold burden. But at a certain point, mold colonizes the body. It colonizes the sinuses and colonizes the intestines. And binders are going to be, again, symptom management tool. It's not going to get rid of that infection. So we have to, in my opinion, you might hear a different opinion from a different physician. In my experience, we have to go into the world of nystatin, itraconazole, these actual mold killers or prescriptions to resolve the chronic issue. And because mold colonizes the sinuses, if you're only doing oral medication, you're missing half the battle as well. So you have to do intranasal prescription medication to make sure you're dealing with the colonization here and colonization here. For the parents out there and the moms, mold is the great masquerader, is what we call that. It can show up in so many different ways in the body. Because it colonizes the sinuses, it has direct access to the blood-brain barrier. So we have memory, focus, concentration, anxiety, depression, insomnia. So a lot of nervous system disorders and issues.
Do you see OCD as well?
Absolutely. ADD, ADHD, OCD symptoms, tics, right? I mean, all of these things, tics meaning like, movements that are not controllable.
What about pandas?
Yes, so I'll see a combination of like chronic strep infections or staph into the sinus tissue that can lead to issues. But a lot of times there's co-infections. So how I describe that to patients is like, when your body's already dealing with something, it's just that much easier for another infection to jump on board because your immune system's already preoccupied with trying to deal with something over here, right? That it's just that much easier for this next infection to just hop on the train.
And that's why I asked that question, because it's so frustrating. Moms are out there, they're trying to get answers for the panda. You can explain that, but they don't deal with the mold. And now I still have a fertile ground for it to reoccur.
Right. And then so they're doing antibiotics, right? But I mean, one of the main issues with antibiotics is that it's going to increase fungal issues, right?
Exactly.
So that's that double-edged sword. Like if you're not, so the nasal spray that I use is called BEGI. It has Bactrim, which is an antibiotic, VTA, gentamicin, another antibiotic, and itraconazole, which is an antifungal, because I don't want to miss anything, right?
Yeah.
Because if I'm just sticking antibiotics everywhere in the body and there's a mold issue, you're either going to get way worse or not better, right? Because we're just giving the mold brand new real estate to just hang out and squat, right? And that becomes a much larger issue.
Wow.
And I hear that all the time too. My kid was doing great, took antibiotics, and then all hell broke loose, and I'm not sure what's going on. Well, you got rid of all the good bacteria, and then the mold or candida issue just decided to take over, right? And we hear that a lot. During COVID, for example, I have a lot of families who are like, hey, everybody was fine, but then when we started doing learning from home, that's when issues started to happen. If they're living in a moldy environment, they're no longer spending, 12 hours a day outside of their home, outside of that mold, and they're literally 24/7 in that environment, and their body just can't handle it, right? The body had a respite when they were at school or at work or whatever, and now we've transitioned to you just being in this moldy environment and doing your homework or listening to classes or whatever, and you're just stuck in that. And then again, all hell breaks loose in that situation. So
another tragic thing about the whole COVID thing.
Yeah.
Oh, yeah.
We can have, 3 podcasts on. So, moms, for me, heavy metals for sure play a role in that. Heavy metals is sometimes a little further down my list in terms of thought process. But, depending on exposure, if I have a welder who is 55 years old and has early onset Parkinson's and dementia, I'm going to look at heavy metals, right? That's why my intake, like you said, is really extensive, and I ask a bunch of questions because it really helps tailor where we want to head and how we want to start in terms of testing. And patients will come to me for a second visit to review all this information before we start any protocols, because I'm not going to sit there and, like I said, put you on a bunch of stuff before I know what's going on, or recommend tons of IV therapy or exosomes or stem cell and all these other therapies which have their place, without having a true and proper diagnosis of what's going on first.
So would you say that you like to have a target first before you shoot?
Yeah, weird, huh? I don't know.
We're all small.
Yeah, well, it's interesting because a lot of patients, they'll come in and say, oh, well, I did exosomes and I did stem cell and it didn't do anything. And
I spent a lot of money doing it.
Totally. And then I test them for, mold, and I do my chronic infections testing, and they're, heavy mold burden, and they have 3 different infections. And I'm like, you injected stem cells into your body, but it's trying to remodel your kitchen when it's on fire. Like, that's impossible, right? Like, of course, stem cells aren't going to do anything for you because you're injecting them and you have raging infections in your body. They're just basically burnt up by the amount of inflammation and garbage that you have in your system. Patients might feel better for a little while maybe, and then everything comes back. So again, stem cell has its place. Regenerative medicine has its place. We have to be better at being physicians and not selling these regenerative therapies. And it's really frustrating when I see the amount of marketing that's out there for these regenerative therapies. I tell patients there has to be a systematic approach. Once I get rid of your infections, if there's something left that we need to deal with, let's talk about stem cell, exosome, and those types of things. But 90% of the time, all of that stuff goes away, and then I don't need to have you spend $5,000 to $20,000 on regenerative medicine because it's not necessary anymore, right? Because the body has this amazing capacity to heal itself when you give it what it needs and get rid of the issues that are getting in the way of proper healing.
What a thought.
I know. Well, and what about prevention? I mean, I know a lot of people come to you after they've been through a lot of different doctors. What about prevention? I know you've got a lot of modalities in your office. I've been there. Amazing. So let's talk about prevention a little bit.
I have these like dichotomous favorites, right? When it comes to patients, one is that like 15, 20 years down the road, 40 doctors and mystery case. That is a great case because I can, it's a blessing to bring healing to someone like that and be a part of that story. It's also really nice when you're working with someone who comes in and they're like, feeling pretty good. How are you going to help me stay well? And I'm like, fantastic. I would love to do that, right? And again, that's where normal labs have their place. Liver, kidney, thyroid, cholesterol, immune system. How do we optimize function? So the word optimization is very different than normal, right? I can have a normal vitamin D level anywhere from 30 to 100, right? And again, the Western medical model considers that normal range. I like that between 60 and 90, right? B12 drives me insane. So a B12 level, a lot of times, a lot of labs go from about 150 to 1200. That's like 0 to 10,000, right? That's not helpful. What's crazy too is that a lot of labs, if a patient comes back between the level of 2 and 400, which is really low in my opinion, which is normal, they'll have a little disclaimer on the actual lab saying 5 to 10% of patients between this normal value have neuropsychiatric changes and red blood cell changes, meaning their red blood cells are too big because they have a B12 deficiency. And then I just rack my brain and I'm like, if that's true, why is that even a part of the normal range? Take it out of the normal range and start at least 400 and up, right? So in my world, when we talk about keeping people healthy, let's go over labs. But when I go over labs, I go line by line. And Dr. Harmon knows this really well. We talk about CRP, HS. And what does that mean? That's an inflammatory marker for the heart. I'm taking notes on the piece of paper and they have theirs in front of theirs. When we're done and we've gone through everything, we switch. So that patient has all of my notes written down. Because as we all know, you're going to go home 2 hours later and be like, what does EGFR mean again? I don't know.
Yeah, trying to explain it to a spouse.
Exactly. Right? Your spouse, my spouse, has lots of questions. And, you go back and they ask, well, what did you learn? Or tell me about ozone therapy and what is it doing in the actual joint? Or, tell me about your labs. It's nice to have that all written down and then have a really, really concise and detailed treatment plan of this is how we're going to address these things. And then when we have those treatment plans, I write down a supplement, but right next to it, I'm going to tell you why you're taking it, right? Because a lot of times patients, when they're 15, 20 years down the road and they come in with their bag full of supplements and they lay them across the table for me and I'm like, why are you taking this? And they're like, I don't remember.
They have no idea.
They have no idea. So, a lot of times when I work with patients, I'm actually taking away 75, 80% of what they're on, right? Because it's really not necessary. Again, fluff. And again, supplements are supplements for a reason. They're supplemental. They're not necessities, right? So they are tools, in my opinion, that should normally be used for a time period to bring patients back to optimal wellness. And then we should be able to wean people off of those supplements.
Yeah, you don't often hear permanent supplements.
Yeah, right.
How long do I need to take this? The rest of your life.
You have that patient on probiotic forever, but in my opinion, before the last 10, 15 years, nobody's been on a probiotic all the time.
Right.
You know what I mean? Like, how did we survive up until this point without probiotics, right? Do you maybe need
we ate Whole Foods.
Yeah, right. Exactly. Does a probiotic a couple times a year be helpful? For sure. Do I want you to switch which probiotics you're using because there's different strains of different good bacteria that I think you should be exposing yourself to? Absolutely. So, there's these conversations with healthy individuals that they still get a lot of information in terms of how we can, again, optimize health and making sure that we're keeping them well. Or a lot of times, these optimal patients feel better, and then it's kind of like cooking the frog to death really slowly. Have you heard of that before?
Oh yeah.
You raise the temperature of a frog in a pan very slowly. It doesn't know that it's dying. The same thing is true. Like we deteriorate slowly, and you think you're healthy or feel good, but then when you start to remember what feeling good feels like, you're like, oh my gosh, I had no idea that I wasn't feeling the way that I used to, right? So a lot of those optimal patients, we optimize them further, right? And they are very pleased with the responses that we have in keeping them healthy. Great modalities and tools. Ozone is one of the most antiseptic properties in the world. It's 1,000 times more antimicrobial than chlorine is. So when you introduce it into the bloodstream in a very strategic and systematic way by a trained physician, it is very helpful at getting rid of chronic infections. It's super oxygenating your tissues. So the first two places that ozone will travel to is the heart and the lungs. If we're already putting it into the bloodstream, it's going to help kidney function, circulation, inflammation in the body. So there's so many reasons why ozone is helpful in the body. Ozone's been around over 75 years in the United States, over 100 years in Europe. There are more research papers on ozone than there is vitamin C at this point. There are countries that have centers for the development of ozone in medicine already built into the makeup of their country. So unfortunately, as we are all aware, most of us, at least listening to these type of podcasts, the Western medical model is an illness-based model, right? If we want to transition to a wellness-based model, what tools do we have to bring wellness versus taking medications from a reactive standpoint to help deal with an issue? Ozone is one of those great tools because it's so anti-inflammatory, helpful for circulation, very good for blood sugar and cholesterol management, again, from that chronic infection standpoint. So, my healthy individuals, they'll follow up maybe 3 to 4 times a year for some ozone therapy. And again, patients learn really quickly. I'm not here to sell you anything. Both of you have learned that really quickly working with me. If you're pretty optimal, I'm not going to sell you 10 sessions of 10 pass therapy. It's not necessary, right? You're healthy. We just want to keep you well. So why don't you follow up with me a couple times a year for some ozone? That way we just keep you healthy. We monitor labs, making sure things are good. There are patients in that type of situation where we will do the mold testing and Lyme and those types of things anyways, just to make sure we're not missing anything. Because again, you get to a certain point where the body can handle maybe a dormant infection for so long, and then you hit the age of 55, 60, or you have a traumatic episode in your life, or you go through a divorce or a stressful situation, your immune system tanks, and then whatever that bug was rears its head and creates these chronic conditions, right? So I've never been the same since is a very common conversation in my practice. If we can find those infections before they manifest in terms of symptoms, obviously that's best case scenario, right? They say an ounce of prevention is better than a pound of cure, right? So
yeah,
we do everything.
It's interesting. You talked about developed in other countries.
Yeah.
And it was in countries like Cuba. They didn't have very much money, so they had to do things that were cheap.
Yep.
So they started doing things like rectal insufflation with ozone to kill things in the colon, and then ozone therapy, blood type of things, because our system is geared to manage diseases, not to cure them.
Right.
We'll manage it, and we'll make a lot of money on you. So that's one of the things I really loved about doing ozone therapies, was the fact that it was getting to the core of things and had so many uses, whether injected, like insufflation in the sinuses or in rectal insufflation. I don't know if you guys do that there. You probably don't have to when you do the 10 pass.
So ozone IV therapy. So I would say the traditional way, I don't like to say the old way, but the traditional way of using ozone therapy was called major autohemotherapy. Call it MAH for short, because it's way easier to say. And what we do is we access a vein. Usually they'd put either a tourniquet or a blood pressure cuff on the arm. They would put the IV bag on the floor. That bag would fill with your blood through gravity. And then after it gets filled to a certain point, they would hang it back up, throw some ozone in there, shake up the bag, and then it would drip like a normal IV back into the bloodstream. So that is something that can be really helpful, and it's a great tool to have, and it is a therapy that I was using prior to using 10-pass therapy. That treatment is going to take about an hour or so to do that process. The way we do ozone therapy now, we use something called hyperbaric ozone IV therapy, or a 10-pass machine, where we access the vein. The machine will vacuum that blood into a bottle for me. That bottle is always in constant motion, making sure that the blood stays nice and kind of smooth for us as we're running the therapy. And then once that bottle reaches a certain level, we'll press another button on that same machine. It'll ozonate the blood, and then it positive pressures it back into the bloodstream. So that same pass in and out is going to take 5 to 7 minutes versus 45 minutes to an hour of the traditional way of doing ozone therapy. So what that means is I can do that pass 10 times in a row, and I'm already treating, approximately 2/3 of your blood volume, depending on the size of the patient, right? You have a, 4 foot.
Rather than 60 cc's of your blood.
Totally. And, a lot of
MAH.
A lot of doctors don't want to put the bag on the floor because it doesn't look good when they do it the old way. So they'll pull the
First time I saw that at a Schallenberger conference, I'm going, what the heck?
Yeah.
That doesn't look very sterile.
Yeah, so they'll pull the blood out in a syringe, but it's very little. It's about 60 cc's, like you said, and then they'll put it in the syringe. We're pulling out about 200 to 250 cc's at a time. So the amount of ozone that we're treating in one bottle is already, 4-ish times the amount of blood that we're treating just with one pass, right? And I can do that in 5 to 7 minutes, and then multiply that by 10, right? So that can be really helpful really quickly.
For all kinds of things, even some fast-growing cells.
So I have a quick question. What's the youngest age that can get ozone therapy?
So lots of different ways to introduce ozone into the body. So one way that we like to use is called ear insufflation. If you can Google this, if you look at really good pictures of the tympanic membrane, you're going to see thousands and thousands of little vessels. So when you put enough pressure, and it's not painful, but if you put enough pressure and concentration of ozone in through the eardrums, and how you do that is basically wearing like a stethoscope, and the stethoscope is hooked up to the ozone machine and it feeds the ozone into the ears. You can have systemic ozone through the eardrums. And a great proponent of that lives in Star, which is amazing. He's a dentist, been doing ozone for 40 years, Dr. Dennis Mahalka. I love name dropping my colleagues because they're amazing. I refer to him a lot in these types of situations. If we're talking about infants or these younger kids who could absolutely benefit from these therapies, using that ear insufflation as a treatment is helpful. And the machines they're not that expensive in the grand scheme of things. You could probably buy one of those machines with all the setups for somewhere around $1,200 or so. So if you think about it, if you're coming to my office 3 times a week, I mean, and you're paying me, $40 to $60 a session, I mean, you're going to pay for that machine after you've used it 30 times or whatever, right? So, I mean, sometimes I tell patients, like, don't come to me, just buy this machine and use it at home. And, patients are really appreciative about that because they, like I said, they know I'm not trying to sell them anything. I want them well. And if we have a tool that can get them well, we have a tool that they don't necessarily need to come in for IV therapy, then let's recommend that tool, right? Like I said, not everybody's going to get recommended 10 sessions of 10 pass. And even with 10 pass, Dr. Harmon, I have a patient right now. She's relatively healthy. She thinks she has mold exposure, but generally doing well, some fatigue issues. I recommended ozone, but I said, you know what? You are not my stereotypical chronic fatigue, fibromyalgia, autoimmune, trying to get disability type of patient. You probably don't need 10 sessions of 10 pass. You can do anything from a 2 pass to a 10 pass in office, and the price changes depending on how many passes you do. So I'm really open with that about patients too. A 2 pass is $255, about $100 a pass after that. So 5 passes, $550, and 8 passes, $850, 3 passes, $350, whatever works for your finances. Any ozone is better than no ozone. So it's kind of that conversation of, we need to be working towards the goal. If we need to modify that goal so that it's financially doable for you, let's try to figure that out together. Where there are clinics out there that will say that only recommend 10 pass, and that's the only option, right? Oh. There is something to be said about that communication with patients, because obviously if they can't afford it, I'm not helping them, right? So like I need to keep that in mind as a practitioner and try to have a plethora of tools to bring change in the body. And again, from different financial aspects as well. So I would love it if I could do 10 sessions of 10 pass and SOT therapy and, stem cells after all of that's done with all of my patients, right? It's just not possible for a good portion of our patient population.
Well, and also with that 10 pass, you have to have a nurse right there monitoring. It's not like you just turn on a machine and it just goes. You know what I mean?
Yeah. So the nurse is there, the whole time monitoring and running the machine and making sure that everything's
not like laying on an infrared bed or something.
Totally.
Red light therapy bed.
Yeah.
See you in a half an hour.
Yeah. So, I mean, I appreciate it as a practitioner because you have that mindset and you understand, the cost involved in running these therapies.
Right.
But, I always want to be aware of, where my prices are and try to be reasonable. And, I tell patients I need to be able to sleep at night. Right. So like when I'm doing a joint injection, a lot of clinics will charge per location, which is fine. They're allowed to do that, and patients could decide if that's what they want to do. I'll charge for the first location, which is $255. And then if you want to add the shoulder and the other knee, it's another $55 per location, right? For me, they're already in my office. It's taking me another 2 to 3 minutes. We're just for the little extra time and the extra supplies that we're using. Because it doesn't make sense to me from an integrity standpoint, personally, to, charge $255 per each location if you're already here and you're not taking up that much more of my time. Yeah.
And since I used to do those prolozone injections, I know the difference. You're already set up, and it doesn't take as much to set up 2 extra joints once you've got the first one finished.
Correct. Yeah.
You know what I mean?
You've already pulled everything that you need. You just grab an extra syringe or 2. It's already ready to go. And then again, it takes another, 3 to 5 minutes to kind of address those other locations. And, patients really appreciate that, right? And that's part of the rapport and respect and trust. Another thing that I tell patients is that I don't I don't surcharge for any of my testing because I don't necessarily have to tell a patient how much the test cost. They can walk into my office for a $500 test and I can tell them that the test costs $1,000. And for me, as a practitioner, as a man of faith, it's a very slippery slope as a practitioner. And I caution other practitioners using that model because you're playing the mind game in your own brain as to whether I'm making that recommendation because I think you need it or because it's going to be beneficial for my pocketbook, right? And then the other conversation is no one takes me golfing, no one takes me out to lunch, I don't receive any benefits otherwise from any of these companies. And I do that on purpose because I always want the patient to know that I'm recommending the test because I think you need it, not because it's helpful for me at all. And
I love that so much.
Yeah, it also builds that rapport and that trust. Sure. And patients know, hey, this doctor is here to make recommendations for me to get better. He understands that obviously this has already been a huge financial investment. I have a company, I won't name them. Our kits cost $400. You can charge anywhere from $400 to $2,000 for the test. Jeez. And again, I told the rep at that conversation, I was like, I don't think you should say that. Personally, like I don't think that should be a recommendation because it doesn't look good, and it makes you question their ethics. Exactly, right. So I mean, that's so what else are they going to tell me? Right. So then, if I buy that kit from that place, patient comes in and tells me how much it costs $400 because that's what the kit costs, right? And a lot of times, if you're doing a mold test, you pay the company directly, so you don't even pay me in my office; you're paying them, right? So like, I don't see any of that, and that's fine. Because that's not necessary, right? I mean, doctors who run a business, but I shouldn't be able to refer for a colonoscopy and get a kickback, right? Shouldn't be able to refer for an MRI and get a kickback, or say it's $1,500 for an MRI, but it's $1,000, and then they're going to give me $500, right? That doesn't make sense to me, and I think that in the naturopathic and supplemental world, it can get really tricky and really slippery in terms of that slope. If we're not being integritous with our recommendations and being very transparent with our patients. Wow, a doctor with ethics. I'm so glad we had you on the show. I could go on for another couple of hours. We will have you back again because there's so much more to talk about. Yeah. But I think that our listeners got a good glimpse into not only your practice and what you do, but into you personally and your ethics as a doctor. And I think it's admirable that you took the time to tell them about what you just talked about. Yeah. That to me, that's really, really huge because you go in with a little distrust anyway. Right. Totally. There's a lot of skepticism as well. And sometimes, patients who are kind of dipping their toes into the natural world because they're at least trying to look at other options if the Western method isn't working. It's already that kind of like scary skepticism. I don't know who to trust, right? Because I mean, there's a million rabbit holes. And sometimes coming to me, I can really hone in on like, this is the direction we need to go in. And I'm not just telling you that I have the data and the information saying this is what we're dealing with and this is how we're going to move forward with your care. And it's a very two-way street, right? There are a lot of patients like who say, hey, can we, instead of starting with ozone, would you work with me with herbs first? And I'm like, sure, absolutely. Let's do that, right? If we can get you better with herbs, let's I'm happy to go down that road with you. If 3 to 6 months down the road and you're not noticing much, then we're going to have to step up our, aggressiveness in terms of the therapies that we offer. But again, it is that two-way street. And I'm totally willing to work with patients. It's not, what Dr. David says goes. It's not my style. I really want it to be collaborative in nature. And it's really common to obviously have the guinea pig of the family. And when they get better, I see the rest of the family coming to. That's right.
Actually, from a mom standpoint, I'm excited that you're in the Treasure Valley in the Boise area, but I'm also excited that you can do telehealth too. So I do want you to speak on that just a little bit because we have listeners all around the world. So I want to make sure we touch on that before we let you go. And I'm so excited that we've had you on because we don't have, naturopath is not a normal word that everybody uses. A lot of people don't know what that is. And I'm very glad that you've been on the podcast today to talk about what you do, locally, but then, like I said, I'd like to touch on globally as well.
So the little elevator speech, sometimes when people are like, what's naturopathic medicine? It's like, okay, well, I went to Pacific University. It was in Portland area, major in biology, emphasis in cellular molecular biology, minor in music, because music is amazing. Cool. So in naturopathic medical school, the first 2 years of medical school are the same as any other medical school in the country. Anatomy, physiology, biochemistry, all of those foundational studies are the same. The last 2 years are just a difference in philosophy. So not only do we learn the pharmaceutical meds, what are the drug-drug interactions, how to wean people off of medications, how to read images, referrals, all the primary care stuff. We have all that knowledge. We have so many extra hours and tools in our toolkit in terms of botanical medicine, chiropractic techniques, nutrition, and we kind of start specializing in these other areas, like I've talked about in terms of chronic disease and degenerative disease. There is a time and place for the Western world, but again, the tools that we have, and again, when I graduate, 4 years of undergrad, 4 years of medical school, a year and a half of residency, I mean, that's 9.5 years of higher education before I'm opening up my doors and seeing patients as a sole practitioner. In some states where naturopathic medicine is not regulated, you can take like an online course, right, for 30 hours and call yourself a naturopath, right? So there is some discernment involved in that, and making sure you're asking the right questions to naturopaths, to making sure that they are naturopathic medical doctors and have an actual degree from a medical school that is certified to graduate naturopathic doctors. We started our practice in Portland. We moved to Boise. We actually still have that practice in Portland area. So if there are listeners in the kind of Northwest, we have patients, travel as far as, Bend or as high, north of the Canada border to come see me or work with me, or at least our clinic in Portland area. And then, have clinics our patients fly over from all over the United States to come work with me for very specific treatments that we can talk about more in the future where I need them in office. But it's very common for me to work with patients from, all over the country or internationally, because we can mail them the test kits. We can find lab locations in their area that will do the blood draws for us, because it's a specialty type of blood draw. The urine kit for the mold is an at-home test anyways, so you don't need to go anywhere.
Great.
And that the UPS shipping label and everything that you need is already in there for you, so you just drop it off. We'll get results in 3 to 4 weeks, and then we talk about treatment plan, and then I can ship you supplements and figure out how to get you, the supplements and medications and things that you need to move forward. So there is a little more involved, obviously, in that. I don't charge anymore for that. I mean, it's all the same to me. It's just, making sure that we get things lined up in a manner that's pretty streamlined and straightforward in terms of what that looks like. Like I said, work from people from all over the country. And it's very common for patients to want to establish care and actually come see me first to just meet me. And then I keep in mind that obviously I totally understand that you're from wherever. It's not feasible for you to come in, however often, we'll do all follow-ups via telemedicine, and then, keep adjusting protocols based off of your location. And, like I said, I had that person from Utah who probably has that, has that tick-borne disease and anaplasma, who is diagnosed with the Parkinson's dementia. My goal right now is to find him an Ozone clinic in Utah, right? Like I don't want to waste their time, because even the logistics of having someone like that and the wife trying to help him travel to get to my clinic once a week for 10 weeks? Absolutely not, right? I will not recommend that. And that's how, again, patients, you build that trust and rapport, because I'm not telling you need to come see me. I'm telling you need this therapy, and let's get you this therapy wherever it exists.
Part of our podcast is educating people. And I love that there's education there, but then there's also referrals, and there's actual, ethics. Dr. Harmon said earlier, a doctor with ethics. With everything that's coming out in the news the last few months, that's something that all of us take near and dear. We take talking to patients, I talk to other moms. I'm a health coach. We take it very seriously, and we strive to really be there for patients and moms and dads in a real way. And, what's best for them. And you've said it several times, getting to the root cause. That's all we want, is we want people to feel better and live amazing, optimal lives.
The last thing I would say is that so my clinic here and my clinic in Portland, we do free 15-minute consults. So, wherever you are, we can have that conversation over the phone. You can pick my brain. I'll give you an idea of what that approach would look like. Again, pricing and all of that stuff is a part of the conversation. I'm all about full disclosure and all that information ahead of time. And I'll do my best in my ability. Like, okay, if you have these infections, this is what this would look like, right? But I need to do the testing first. So I'll give you an idea of how I would approach if I think this is what's going on. Yeah. But sometimes that's really nice, because you get to talk to me over the phone. You can hear my bedside manner. I'm not a jerk, right? So like those types of things, kind of nice. And then there's no strings attached to that conversation, right? Nobody signed up for anything. You're not on my mailer list for anything. I'm not gonna, spam you with a bunch of stuff. If you want to move forward, fantastic schedule. If not, no strings attached. I wish you the very best. And there are patients who do that consult, and I hear from them 2 or 3 years later, and I start working with them. But again, it's that exposure, right? It's that education. And if they're not ready for it, no problem. If that's something that you want to start moving forward in the future, I'll be happy to work with you.
This has been so informative, and I want to thank you for being on with us today. I don't think it's going to be long before people are going to be saying, hey, could you do an interview with Dr. Palacios again?
Yeah, I'd love it.
Yeah, we'll have you on.
Talk about it. So when you love what you do, it's just really easy to just literally.
Oh, absolutely. And I think that our listeners, our watchers can feel that as well.
Yeah.
That you're just straightforward. You just want to get people better.
Yeah.
And that is so needed. You go to the doctor, a couple of sentences in, he makes his diagnosis, here's a drug.
Right.
And so I don't think you do that at Eagle Regenerative Medicine.
No, not our style.
Boise.
It's refreshing. It's refreshing to hear somebody that wants to get to the root cause, and then,
yeah,
you're good. Instead of let's write a script and keep.
We'll have a caricature made of him, and he'll be our logo for root cause.
Like this.
All right, friends, thank you again for spending your time with us. We know that you have choices and where you spend your time, and we are very honored that you chose this time to be with us today and to talk to Dr. David and learn more about what he offers in his practice. Stay grateful, stay grounded. Until next time, Root Cause Holistic Health.
Thanks for tuning in to Root Cause Holistic Health. We're here to help you uncover what's really going on and empower you to take the next step in your healing journey.
Whether you're a mom, a dad, or just someone ready to stop settling for Band-Aid fixes, we hope today's episode gave you something to think about.
If you found this episode valuable, do us a favor, share it with someone you love, and leave a review so we can reach more families like yours.
Make sure to hit follow so you don't miss next week's episode. We've got more honest conversations, practical tips, and root cause wisdom coming your way.
Until next time, stay grounded, stay curious, and most of all, stay connected to what truly matters.
We'll see you next time on Root Cause Holistic Health.